It's the Talk to Me Network on AM 1510, FM 99.9, 94.7, and 100.7. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, radio arm of Helping Seniors of Brevard.org. That's our website, helpingseniors.brevard.org. Our purpose is to inform, educate, and connect seniors and those that care for seniors with services. We have some wonderful services in Brevard County, but unless you know about them, they don't do anybody any good. So the purpose of this radio show is to help inform you so that we can ask you to tell others about this radio show, about what Helping Seniors does, and what all our partners do, and the wonderful people that they are that take care of people. I spent this past week answering the phones because one of our people's on vacation. So, at Christmas time, the calls have slowed down a little bit, and I would have expected them to pick up, but they've slowed down a little bit. And as with some of these calls that come in, it makes me aware that so many of you simply don't know that there's very, very low-cost services out there in the market that can help you live an easier life more safely and certainly with less strain and less stress. And that's why I'm going to push harder in 2017 in all my newspaper columns to do a better job of letting all of you know what's available. But I say it with the proviso that I'm asking you to tell your neighbors, your friends, and your family members about all these people that provide these care services, especially a lot of the in-home care services, and that's what my show is going to be about today. But just let me mention some of my sponsors, because you'll see that the sponsors are the type of organizations that do just what I'm talking about. Kindred at Home, the Eye Institute, Dr. Lee Sheldon, who has a charitable giving program, and if a person comes in, gets a free dental examination, x-rays, everything, and for a donation of $50 to a nonprofit organization, Lee provides these services to these people at no cost. So he's raised over $100,000 himself and given this to charities to help. And that says a lot for providers in our area, folks. Bill Johnson, elder law attorney. This radio station, Woodstock Hospital System, 11 Home Care, Zon Beachside Assisted Living Facility, the Ebony News Today, the Riverview Senior Resort, Organized Creative Demonstrations and Solutions, Brevard Chiropractic and Neurogen Center of Rockledge, and Cobblestone Real Estate and Market Street Memory Care. Those are all services designed to help seniors. And the reason I mentioned the retail services, we have two real estate agencies that are sponsors of the show, and they do a lot to help people, especially seniors, when you're downsizing and when you're moving into a new home. If you don't understand certain types of insurance and preventive care that you can put in place to protect yourself, you can cause yourself a lot of grief. People that know the market, know what to do, they can help you prevent yourself from getting yourself in trouble. So, having said all that, let's just talk today about what I'm going to title my show is Elements of Home Care. And with me is Dr. Christina Paff and Steve Paff, her husband, who are the owners of InHome Personal Care. And I'm going to let both of them talk about their services because they're going to be able to tell you the types of things that they can do to make your life easier. So who wants to go first? Steve? Chris?
Go ahead. Sure.
Go ahead, Chris.
I'm the one that likes to talk all the time. So.
Okay.
Well, good afternoon.
I understand, Steve.
Right, exactly. It's a tough life we live, huh?
Yeah.
Well, we very much appreciate being on the show today. And we own InHome Personal Services, which is a private duty caregiving company that helps with everyday care items. Anything from getting up out of bed to going to doctor's appointments, helping you with medications, going shopping, light housekeeping, anything that we can do to help make your day easier and safer is what we do. A lot of times I tell people, call me and ask me what you want instead of me telling you what we can do, because that list is much longer. I can easily tell you if we can't do something, more so than everything that we actually can provide to the seniors in Brevard County.
That makes a lot of sense, because I took a phone call this morning, Christina, and I asked a person what they really thought they needed, and she told me, and then I said, well, how about shopping and going to the grocery store? She said, oh, my husband still drives, and he's 90 and she's 93, and he still drives, she said, and he still cooks. And so, but they realize that one of the things I think, and I'd like for both of you to answer on this, do you find that one of the services that seniors need more of than anything else is help with house cleaning?
Yes, because of the safety implications that come with running a vacuum, dusting, bending over, picking up things off the floor, moving little figurines. If they're a little shaky, they could drop it, glass breaks. Even all the smells that come from all the house cleaning products can make people dizzy or get headaches. So there's major safety implications when it comes to just general housekeeping that are things that we can definitely assist with. And what I like to tell a lot of people is that we are there to be an extra set of arms, an extra set of legs, an extra brain even every once in a while. We're not necessarily there to do it for you, because we want to keep you as independent as possible and want to help you do it instead of do it for you. We don't want you to lose what you already have.
But I understand what you're saying, but some people, there's another side to that too, Christina, since I'm closer to that point than you are. While you're a provider, I'm one of the ones that might need the service.
Right.
And so I know if I bend over and if I hold my breath, it could cause me to pass out.
Right.
So I try to exhale when I bend over, or keep breathing through my mouth so that there's no pressure on my brain, or, well, on my head. I'm not going to talk about my brain. I'll talk about my head. You agree, Terry? She won't answer. But it's something that you need to think about as you get older, and I think it sometimes can be a mark of stupidity as we get older if we think that we can continue to do some of the things we did when we were younger simply because we don't want to give up or give in. That's what we feel. That's not a question, is it?
No. I mean, in the scheme of what you could be giving up, house cleaning is not something you should be worried about giving up. That should be one of the first things that you have somebody come in and help you with. Giving up walking or giving up not standing up from a chair, those are things we don't want you to give up, and that's where we can really help. But house cleaning is one of those tasks that you've been doing for 60-some years. It's okay when you're in your 80s, 90s, even 70s to have somebody come in and help you. That's an easy part, because it's one of the biggest safety concerns that people have in their homes. Kitchen, bathrooms, and cleaning are the three major things that can cause a fall. So giving that up isn't necessarily a bad thing, but we don't want to give up the important aspects of your daily life, like the walking and the getting dressed and the taking showers and maybe doing a little cooking for yourself or going to run errands. Maybe you don't drive anymore, but we can do that part. You can still come with us.
I think it makes more sense for those of us that are getting up in years to figure out some of the things that we really should be getting rid of and giving to somebody else. First, I was concerned when I took the phone call, because I'm sort of sitting in for Kay this week and answering the phone and giving advice to the callers about what they should do or what I think they should do, or how they might get the type of help that they need. But I've always found through the years that when talking to seniors over the telephone, invariably just the process of the call will lead to other needs that the person has other than what they thought they wanted when they first made the phone call. There are so many things, and we have to be concerned about directing people someplace to get a service when they can't pay for it, or there are no federal or government funds available to pay for it because there are just so many things that older American money will pay for, and you have to be careful about telling somebody that they're going to get these things free. Steve?
I agree wholeheartedly, and it's a kind of a tricky situation sometimes because the money is there and it's available through some of these different grants and associations and things like that, but it's difficult when you would expect veterans benefits. Well, what they don't tell you is that the qualifications to actually receive those benefits, there's a very long list of that, and it's a process. It's an application process. It's a lot of time. Now, it does get expensive. It's tough, when you're dealing with government agencies and funding and things like that. So, for our business at least, we try to set our pricing structure so that we are very affordable, and from what I'm aware of, we are significantly less than our competition, and you're going to get the quality of care that really you deserve, and like we were saying before about maintaining independence. But if you don't want to clean your house anymore, that's okay too. And we're more than happy to come in there and carry some of the load for you and help you to really just continue your daily life.
Yeah, I want to spend a little extra time today on this topic that we're talking about, is housework. Mm-hmm. Because if a younger person than you, if for an older person, we don't see all the dirt. We don't see some of the safety items that are cropping up because we've lived in that house so long. It seems like it's safe to us, where in fact it might not be safe at all.
Right.
And by having a service such as yours come in, your people and you all, when you do your home assessment, I want you to talk about home assessments too, Christina, but there's so many things that your people and you see that you can point out to the person that will make it easier and more importantly safer, because so many seniors fall in their own home, and the fall can be attributed many, many times to safety issues in the home that they simply just didn't see.
Yes.
So,
It's pretty simple too. Some of the things that that we look for in the home assessment, and I'll let Christina elaborate on this a little bit more. But we will come in there, and the home assessment is free, by the way, so people can call us, and we can come to their home at no charge and give them an assessment, and kind of, even if we don't provide services after the fact, at least it's a step in the right direction, and we can give them advice that otherwise they may not have gotten if they hadn't called. So, but Christina does come in, or one of our other people comes in to do these assessments, and they really do take a hard look at the living situation. And Christina, I'll let you elaborate a little bit more on that, but I want to hit on the point, Joe, that you just made, that it is important that you at least acknowledge that there are things that maybe you've lived with, like you said, 50, 60 years,
yeah,
and you don't notice it. And having a third party or just a second opinion come in there and say, hey, that area rug is beautiful, but it's also a trip hazard, and it may be hard to navigate through certain rooms based on furniture placement and things like that. But I think that, like you said, once you get to the point where you call us to come in, it makes things a lot easier from there, even if it's just for advice.
Right. They're opening the door to say, I know I may need something. Tell me what it is. And we know from our side that if we come in and tell you, oh my gosh, you need to change these 10 items because your house is just a mess, that nobody's going to respond to that. We know how to approach the subject gently to the fact of, if we get this piece of equipment and maybe do this, your bathroom becomes 10 times safer and you don't have to worry about this or that. But we always give that reason of why, if you change it, it's beneficial. We also realize that those changes can take months to happen also, but that's the benefit of us being in there on a regular basis to help improve your chances of making those changes to be able to be safer. A lot of times I walk into houses and they could benefit from a bedside commode, not necessarily next to the bedside, but over the toilet. So the toilet is higher so they can stand up from it easier. A lot of people are heaving their bodies off the toilet where they're just hurting their shoulders, hurting their back, putting themselves at risk of falling off the toilet, where a simple thing of some bars or a raised toilet seat could make that situation so much easier. Well, that's not even us coming in for care. That's an adaptive device that you can have in your house to make it so much easier.
But you're speaking from a viewpoint of some of your background. You're a doctor of therapy.
Yes.
So it makes a difference. Most in-home services don't have people with the advanced degree that you have.
Right. I've been doing home care for 10 years. And so I have seen a lot of different homes, a lot of different problems. And the one thing that I always come away with is that no home is the same. Everybody has their own unique problems, own unique issues, own unique homes. Just like we are all unique and individual, your homes are too. And one of the things that I love about home care is the ability to go in and figure it out with that person that lives there. How are we going to make 1 + 1 = 2? How are we going to make that 2 not end up a 5 because you have to go into the hospital? We figure out the problem together to be able to make sure that you're going to be able to live safer. So because of my background, I can really come in and say, so why do you think you need help? They tell me something. I could take one look at something like a bathroom and say, well, if you do grab bars here and a raised toilet seat, you've solved your problem. Or if you move some of your dishes down to the first shelf on your cabinets, you no longer have to get the step stool out to reach into the third and cause a fall hazard. You can get them all on the first shelf. It's little things like that that make people's lives so much easier,
right,
that they can function longer at home or whatever they're calling home.
Well, that's the big thing, is to function safely in their home. And you do, it's just like we worry so much about dust particles and how it affects our lungs. And many people live in a house, and they probably lived in that house for years and never changed a filter.
Right. Well, because as we get older, and I see this, there are days that I even notice this. I'm so worried about just eating 3 meals a day, taking medications, making sure I get myself dressed in the morning, that dusting is not first thing on my list. But after so many months, you get dust buildup. It can increase your risk for pneumonia. It can make your floor slippery if it comes off the table. It can make you then fall easier. There's a lot of things that a simple little dusting can prevent. And pneumonia is something that you don't necessarily, it's not an easy get over kind of thing. You get pneumonia, it could land you in the hospital, which makes you weaker, which makes you potentially need more help in the future, instead of having a company like ours come in to help you with some of those aspects to keep you home and safe without all those added things.
And we can, like with the filter, that's another thing that if it's not on your mind every day, you're not going to remember to do it. I don't remember to change my filter every month. But that's one thing that when we go in and we kind of develop a plan with the client and their family, we say, okay, mom or dad would like you to change their air conditioner filter once a month or every other month or whatever. And that just becomes part of our routine. So now it's our responsibility. We shoulder the burden and we make sure that it gets taken care of. And that's one less thing for our clients to have to remember to do.
Well, I'm going to give a little example, and if it'll show you, it fits right in what we're talking about. We built our home roughly 28 years ago, and we've always been kind of wondering about the airflow on a return back into the air cleaning system through the air ducts, and they put the return high on the wall in the kitchen, and it had one of the paper filters in there. And then we got a different air conditioning system in, and the guy convinced us to put a permanent filter in, and the things cost about $100 each. And these are the washable type filters, and so we did that, and we just noticed we had the maintenance contract on our AC, and turned out we've had a flood 2 days or three, about a week after the guy came out and did the maintenance thing. It turned out what happened, they forgot to glue
Oh, wow.
one of the valves in place on the condensate line, and it was just dripping down through the rubber that protected for the condensate line. But the long and short was that this guy, I wasn't in there, and he told my wife that we really didn't need that upper filter, and
Right.
didn't need it in place, because they cut a hole in the wall and put one in lower. So there's something that doesn't jive, because you just can't have direct airflow into a system without having a filter on it.
Right.
And what I'm saying is that as older people, people get told stories about what you need and you don't need. That's why it helps to have somebody like you all come in and take a look at what's happening and say, hey, is this a safe issue or is it not a safe issue?
Right.
Right, because we can always find the number to call, or maybe it's something that somebody in the office has dealt with, or, Steve does a lot of things around our own house and everything, so he may know a little bit more about the filter. I know a little bit more about medications. Like, there's somebody that we can find, kind of like when people call into Helping Seniors of Brevard, you'll have a resource for them. Well, that's kind of with us too. We'll be able to help them in one way, shape, or form to be able to address the concern that they've been racking their brain about. Well, I can get on Google and find an air conditioning company, or I can, get on Google and find the number for a nearby primary care doctor that they've been so upset that they can't change their appointment, or they can't get into, have somebody come out and take a look at something. Those are things that we can help, like I was saying, be that extra set of hands, extra brain to make your daily routine calmer, not high stress, high anxiety.
That's right. You get these 14 things we were going to talk about, and I was looking at my list, and I think we're probably at number 3 or 4.
That's okay.
But it's
all important.
It's always, when you start talking about home care, there are so many different nuances to what you all do. A quick question before we take the break. Can you help people take a shower?
Yes.
Absolutely.
So you're licensed to do that.
Hands-on care.
Hands-on care.
Yep. We can place our hands on a client to help keep them safe in any task that they're doing.
Okay, when we come back after the break, I want you, Christina, to talk about the difference in licensing between hands-on and care, and make sure you get the right kind of care. And I do want to pursue a little bit more about this cost of services and what you can do. Like, a person might need 2 or 3 hours of service, and how we can cost effectively do more to help people save themselves. All right. With that thought in mind, we're going to take a mid-show break, and please stay with us, folks. We had a couple of interesting things to talk about when we come back off the break.
WMEL. Lillian McDermott, weekdays at noon on AM 1510, FM 99.9, 94.7, and 100.7.
This is Joe Steckler, folks. We're back live with the second half of Helping Seniors, a radio arm of Helping Seniors of BrevardCounty.org. The purpose of our show is to inform, educate, and connect seniors to services they need so that they can live some of their older years safely and with as much dignity as possible. And we don't think about that a lot. We don't think about the safety issue. And I purposely selected some of the questions that we're going to talk about today because they're some of the questions that don't get often talked about on radio shows. And these are the things I think that could convince you that you need to use services like InHome care more than you do. And Steve and Christina are going to talk a little bit about cost and what it can do over a 3-hour period, twice a week, for a whole month, and how that would cost roughly $400, and that's going to enable you to stay in your home and not go into an assisted living facility or some other type of care that you really don't need if you will just make up your mind you're going to let somebody else do some of the hard work that you no longer can do. And that's one of the biggest issues. And I found it, folks, a lot easier to let somebody else do some things that I've been doing for a year because it let me concentrate on other things that I could do. And I had to do some of these things that darn near killed me when I was trying to do them. But I'll just mention so quickly some of the sponsors for the second part of the show include Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Courtney and Braswell Financial Group, Barbara McIntyre, who is a home equity loan specialist, and some of you that need repairs in your home, that's the type of person you need to talk about, because there's ways to fix your home. It doesn't take money out of your own pocket. It just means you may not have as much money to give to your children, but it's important that you, as you get older, live safely in your home. It's idiotic to live with a leaking roof if you own a home. There's just no excuse for it, because you have the money there that can help take care of it. Other things to think about are like Canadian Meds of Melbourne, how you can get medicine much cheaper than you can in certain ways. Vitas Hospice, Handy Pro, the Space Coast, Al Dia Today, the Spanish newspaper, and the people we're talking with today, InHome Personal Care. So, having said all that, Christina and Steve, let's talk a little bit about what can you do and how creative can you be in designing like a care plan for somebody that's in their middle 80s, upper 80s, early 90s, things that they should no longer be doing, and some of the things that you can do to make life easier for them. Go ahead, Christina.
Well, for something for 3 hours, the very first thing that I always recommend to a client to do is have us help them with the shower, or however they're bathing, whether or not that's sitting in the bathtub or taking a shower, because showers are obviously one of the number one fall risk items that you do during the week. You got slippery floor, you got water, you have no traction because you have bare feet on, the list is just endless when it comes to the fall hazards associated with that. So in 3 hours, we can come in and help you take a shower, put lotion on, help you do your hair, put makeup on, brush your teeth, all those things that you do that maybe you have stopped doing some of the things because it just takes too long and you're too tired at that point in time to do it. We can be that extra set of hands to help you with some of that stuff and to make it more efficient so you're not as tired. And then we can help you with maybe getting some breakfast, making sure you take your meds, because taking your meds on a consistent basis at the same time every day can help your bodily systems stay in control with those meds, instead of, today I woke up at 10, before I woke up at 7. Every time you change when you take your meds like that, it can affect your systems. So getting on a routine of being able to keep to that schedule is beneficial. So breakfast, meds, we could run the vacuum sweeper to help pick up some of those dust particles, clean the bathroom up from taking a shower, do your dishes from breakfast, and, if there's a little extra time, we do things like taking your trash out, or, maybe straightening up a few piles of the mail, or helping you even go through the mail of what's important, what do you need to keep, what do you want to look at, what is just,
you just said something that's really important. One of the things that we fail to recognize as we get older is the importance of knowing what each piece of mail is. Mm-hmm. You can cause yourself a lot of grief if you fail to answer a piece of mail that requires being answered. And that's why it helps to have a younger person, I think, that works for an organization like that knows that that's one of the things they're supposed to do, is look for that kind of thing and to help you not make a mistake.
Right. And we have a lot of clients that will come in and they've got piles of mail. And the family will call us and be like, can you please just go through Mom's tabletop? We need the table. We need to see the table. We need all the stuff off of it. And there's bank statements in there and stuff with important, like, personal information that we've helped clients get, a little filing system and keep themselves organized. So when mail comes in, they can put in a certain filing system. So when their children come into town or come to visit, they know exactly where all the insurance stuff is, all the credit card stuff, the doctor's appointment stuff. It's all nicely organized. So it's not just on the table and our client going, I was going to get to that tomorrow. Well, we all know something else is going to come up tomorrow, and the mail is what's going to go to the wayside. So being able to stay organized is very important, so it can decrease your anxiety also of you getting random phone calls about bills that are past due, or, you missed a doctor's appointment, or, we can, staying organized is one of the hardest things as we get older.
Do you find that you have a lot of clients, or do you have many clients that say live here in Broward County, yet their children live outside, and they ask you to look at certain things in the home? Do you find that?
Yes. We are actually in close contact with most of our clients' family members that are outside of the city or outside of the county. We get phone calls from them all the time of, hey, the next time, Brittany goes over to mom's house, can you have her check X, Y, and Z? Because when I called her last night, she seemed really confused about this. That's the whole point of us being there, is that we're a second pair of eyes for the family that lives out of state.
Okay, that's important. It really
So
is.
we go to doctor's appointments with clients, and I get an update from the caregiver of how things went. We can shoot an email to the family. Hey, mom was at the doctor today. Everything looked good. Or they took a little biopsy of this. Or we're on a new medicine for a skin condition, or whatever it may be. But that way they know they don't have to rely on mom or dad of, Mom, how'd the appointment go? They may have forgotten, which if they did forget, they could try to hide the fact that they forgot and not tell them all the information. We can just give them that thorough run through of everything's going on with your mom or dad and keep everybody on the same page.
Okay, now, all the people that you send into homes, are they protected by insurance?
Yes. Through our company as a home care agency, we carry all the insurances,
The general and professional liability.
Well, the reason I'm asking, because I know, and this is not you all, but there was a case that we had not too long ago where the person lost all their rings. And it turned out that the person going into the home had been cited several times before for where there were lost things in homes where she had been cleaning.
Right.
Does your insurance reimburse people for that, or if something like that did happen?
We do have theft as part of our policy. I don't honestly know the ins and outs of the entire policy when it covers theft. However, I can tell you that we will personally make sure that you are taken care of and your stuff is either reimbursed or found.
But that's one of the big things about going with an agency, is that all of our
That's what I was
caregivers
leading
are
up to.
protected by it. There's a lot of individuals out there that are trying to offer their services to people that don't have their own insurance. They're not covered by an agency. There's no checks and balances.
Right.
So if your 85-year-old mother finds this woman that's going to come in and help clean her house, but doesn't remember to ask the important questions of, are you insured?
Licensed,
are you
bonded.
licensed, bonded, all that kind of stuff. You just, for lack of better terms, found them off the street type thing. That's a big problem with the elderly population, is
that's the point I was trying to get you all to talk about, because
and, a lot of times too with the theft, because we have had a couple of things where some people have called us and, hey, we think this is missing. No one ever passes the blame right away, but just, hey, look out for this or whatever. Dad may have moved it somewhere and forgotten. And this just happened not long ago where we had a gentleman call and he was missing some rings, oddly enough, and we were racking our brain, and I obviously questioned our people first and foremost, and we did our own investigation. Well, it turns out that he just put them in another place and forgotten where they were. They were in a cabinet on a high shelf, and no one saw them. Well, we were cleaning one day, and we found them. So,
and he was the happiest I've ever seen him.
And this is just, but that stuff happens, and it's okay. And we try to be as diplomatic as possible when it comes to situations like that. Obviously, our insurances will handle things that are, as necessary, but a lot of times it just is a simple misplacement of an object, or maybe a son or daughter came over and moved something and didn't tell their mom or dad because they just didn't think it was important, and that happens a lot, actually, and people do get pretty concerned and worked up about it, but we always work together to
and that's the benefit of going with an agency, because our caregivers pass level 2 background
exactly
screens.
Right.
Yep.
Yeah.
Go through
look into the credentials.
Level 2 background screen. They have to be CPR certified, pass a drug test. They have to have certain training certificates. For a home health aide, they have a certificate. For a certified nursing assistant, they have a certification through the state. They both can do the same tasks in a home care agency, though. There's no difference. Just one is certified through the state and one is not. But it doesn't change their tasks that they can do. A CNA just has the opportunity to work at facilities if they wanted to, where we don't, as a home care agency, we just work in the home. So they both carry licenses or certificates. Is there anything else I'm missing for what they...
I think that's it. And just real quick, we do also work in facilities. Just our employees are not part of the facilities staff.
You go like if the clients.
We're privately brought on by the client.
Right. So if they live in an assisted living or even independent living, memory care, all that, we do have cases where we go and work in those facilities as well. There's a
Let
few.
me ask a question. You brought that up. Now, why, if a person is in a memory care place or an assisted living facility, why shouldn't the assisted living facility people do what you would do? I understand it because it does happen.
Right. And the biggest thing that people don't understand is that assisted living facilities, nursing homes, memory care, they are just that. They're assisting the individual. It is not one-on-one care. You still have a room that you may have to yourself or share with another person, and there is staff at the facility. Well, that staff has to take care of 20 beds, 90 beds, whatever it may be. There may be a nurse down the hall. That staff, though, is not one-on-one for that individual. So a lot of times the issues that we have with clients in memory care or assisted living is that they need that one-on-one care. They need somebody with them to make sure they're not going to get out of bed when they're not supposed to, because maybe they don't remember to press the call button to get help. Let alone sometimes the response times at some facilities can be longer than what that client can wait for. So having a person with them all the time is beneficial to them, because they won't try to do it themselves and fall. But facilities are just that. It is a facility where there is staff and there are residents. It is not a one-on-one situation. It is a general oversight situation.
Okay.
So we come in to add on top of the care and the services that the facility provides. We don't like to offer the same services because you're already getting those services from the facility. We offer above and beyond from what the facility cannot by law do.
Okay, I understand that all these services that you all provide can be paid for out of one's pocket.
Yes.
That's not a question. But what are some of the other ways that these services can be covered? And I'm thinking in terms of people that have long-term health care policies.
Long-term care insurance is actually a great way to use your insurance money for home care services.
It's a fairly tedious process.
There's a process, but we are very familiar with it, and we work closely with these insurance companies to help make sure that it's seamless.
Okay.
And that once you get through their initial process of getting the paperwork filled out and submitted, from there, we keep them up to date with how the situation is going, and we communicate with the insurance company and the families and our clients as well. And we, from our office side of it, we deal with a lot of things that are really kind of behind the scenes. They never even know.
But now, if they have, if people are using a long-term care policy, aren't there special notes that you all have to keep so that when they're trying to justify the payment of the claim?
Yes. And I'll let Christina kind of get into that one.
Nursing notes?
Yes. So basically what happens is the paperwork we initially fill out is very general to any long-term care. There's, a packet that we fill out, a packet your doctor fills out, a packet that the family fills out for like POA paperwork, advanced directives, all that. That all goes to the long-term care policy company. And what's happened in the past is a representative from the company calls myself or calls our office to ask about that specific individual, because everybody has different amounts of money in their policy. They're offered, so it may say you get $2,000 a month. That's not necessarily, though, what you're going to be approved for, because it's based on the level of care the long-term care policy says that you need. So to say, for an example, we had a client we were seeing for 6 hours a day. Long-term care talked to me for almost 2 hours on the phone to find out what they needed help with. Most policies, you have to have assistance with 2 areas of ADLs. So bathing.
Activities of daily living, which is talking about ADLs.
Yes. So showering, transferring, walking, eating, dressing, you have to need help in one of those 2 areas. So me being a physical therapist, I can really express the safety concern to the company, the long-term care company, to explain to them why they need that assistance. We had a client that was getting 6 hours. The daughter filled out the paperwork, sent it in, and they called back and said, we're going to approve 4 hours a day. So they reimbursed for 4 hours a day of her care from us. Now, does that mean that she only needed 4 hours a day? No, by no means. She wanted 6 hours. She just pays out of pocket for those other 2 hours. But long-term care is saying that we will pay for 4 hours a day based on the pool of money you have in your account and what we're willing to give out at that time. So what happens is they process it through. We send our notes to them every 2 weeks on average with an itemized bill of where all the services are and notes from every day that our caregiver is there. So they can see that there's assistance being done in certain categories.
And our notes are
very detailed. That really helps long-term care policy companies because it's laid out very easy for them to see transfers, walking, showering, dressing. And we fax those into them, and then they write a check to the patient. And
folks, what they're talking about is extremely important when you're talking long-term care. And the reason I know this is because I was involved with the care of a retired Marine colonel many, many years ago when I was at Auburn University as a professor of naval science while I was still on active duty. And the wife got a bill from this insurance company for $100,000. And what they claimed was that the nursing notes had not been properly maintained. So they tried to get $100,000 out of this family. Of course, we were able to show them that, in fact, the nursing notes have been kept. The family didn't realize what they were asking for. This is why you have to understand everything is that policy, because the other part of the question, I think, help our listening audience understand this, is that you're talking that the long-term care policy would cover like some in-home care, but it'll do that. But then when it goes, if you got a three clause policy or a 4-clause policy, you might get a couple of years of in-home care, or you might get a couple of years of assisted living and then get nursing home care. So these policies break down different ways, and you might end up with getting 8 or 10 years of care at $175 a day if your policy is written correctly.
Right, you really have to understand what your policy is allowing, and that's why when we had one client that didn't even know she had long-term care insurance, sent a caregiver in, started going through all her paperwork. Caregiver called me, Christina, I think she has a long-term care policy. Well, at that time, her bill just got a lot easier because we were able to submit all the paperwork and get reimbursed back for the services that we had been providing to her. So it is very important to know all the different options out there. And because of my background in being a home care physical therapist, I understand how to talk to insurance companies fairly well, and I can help bridge that gap of what can the client do, what can't they do, what do they have to do to approve for something or qualify for something, and I can pass that information along.
But also extremely important, Christina, is the fact that your background enables you to talk to families and say, this area really is covered. You don't know this, but this area is covered, and you can get more care for a longer period of time and enable the patient to be safer and to live more comfortably. And that's why knowing the ins and outs of these long-term care policies are really different. The last thing I really want you to mention is a little bit, what kind of transportation can you provide to families?
We are covered underneath our insurances to either drive the client's car, say a client has a car but they just can't drive anymore. We can drive them around in their own car.
Or a Jaguar, if anyone's got one laying around.
Yeah, you didn't want a Jaguar.
No.
Maybe next time.
We're working on Mustang for next
that's
year.
Right, I'm ready for it.
Or we can have the client in our caregiver's car. We have both insurances to be able to cover clients in our caregiver's car or our caregivers driving the client's car. So we can take them wherever they need to go.
Would there be a difference in the cost?
If it's over a 5-mile radius from where their home base is, we charge 50 cents per mile, which is pretty much the federal average for miles. But a lot of places that people want to go are right down the street to the Publix or to the Walmart, or it's near home. So a lot of times there's no mileage incurred, but we always let people know if you have to go further than about 5 miles, it's a cost on our caregiver too if they're driving their own car for gas and all that kind of stuff.
The other thing is that you do not have a required minimum either.
No. We'll come in for 1 hour a day if that's necessary.
Yeah, so if somebody wanted to go, you could probably take them to run 2 or 3 errands
in an hour or two and be fine.
Yeah, and And that's so much cheaper than a taxi cab, plus the fact that your person's with them for the safety factor.
It's safety, exactly.
Yeah.
And they're trained to handle that situation.
Okay. All right, folks, we're out of time. And I hope you've enjoyed listening to Christina and Steve talk about the in-home personal care. If you have a question, call them. What's your phone number?
321-984-0706.
Okay. Thank you, folks. If you have a question, call me at Helping Seniors, and we'll get you connected with Steve and Christina. Thank you.
Thank you.